So we're going to put some volume into the mid-face and the cheek area now. I've assessed the patient by sitting the patient forwards and looking at the areas of volume loss, and I've marked this up for now, filling the area with the cannula. So we're going to make a little input point here with the introducer needle. Now when we looked at the volume loss on both sides of the face, we felt there was slightly more volume loss on this right side. So we're going to put more filler into this area just to balance the face and give more symmetry. Turn a touch to the left for me like that. So again, just check the tip of the cannula is in place in the zone, and then we'll slowly inject and add volume. And what we do is we just fan across the area, layering the filler normally into the deep fat area of the face or just onto the surface of the bone using the cannula. And just kind of slowly volumize across the area. So volume loss is common in the mid-face, and there's different severities and stages of volume loss to the mid-face. One of the things that can happen with losing volume in this area is deepening of the nose to mouth lines. So sometimes we find that these can become deeper because this tends to drop and falls towards the nose. And one of the benefits of doing this treatment is to give improvements to the nose to mouth lines as well. I always say that when patients have volume in the mid-face, usually this treatment is a really good treatment for freshening the patient. It's one of those treatments which makes the patient look younger, but isn't an obvious treatment result. So as you can see, it's not a particularly painful treatment. The patient doesn't really feel too much pain, just feels generally pressure. So again, we're going to add volume to the left side now, which was slightly less volume depleted than the right side. Just using the introducer needle there so we can introduce the cannula. Again, just check the tip is in the zone of volume loss that we've drawn, and slowly lay the filler into the area. Once we have placed the filler, we'll then have a press and manipulate the filler and smooth across the area just to make sure it's nice and even, nice and smooth, and looks natural for the patient. So what we do now, we have a little press across the area just to make sure the filler is in the location that we want. Now the filler can be kind of slightly moulded. It shouldn't be movable, so we can't move the filler essentially to a different area, but we can kind of model it, so to speak, just to make sure it looks perfect.